Okay, we're going to talk about setting lingualized posterior teeth for our complete denture patients. First thing you want to start off with is putting marks, which you should already have, but if you haven't, you want to put 3 marks on the cast. One that's denoting the center of the ridge, one that's 2/3 up the retromolar pad, and then one more where the mandible starts to elevate. Again, the one for centering over the ridge is going to help us to set our teeth up so we center them over the ridge. The 2/3 up the midline is going to help us as far as the occlusal plane. And the last one, the one where the mandible starts to elevate, is really there to help us as far as selecting how many teeth we're going to be setting. So you go from the distal of the canine, which you have already set in the patient's mouth, and you just can very easily just hold the card up to the cast, holding the mesial of the first premolar up to the distal of the canine, and then looking to see how far back the teeth go in relationship to that mark that denotes where the mandible starts to elevate. The most common tooth, if you're going to leave one off, is usually the first premolar. In most of the simulated situations, I believe there should be enough room for everyone to set all 4 teeth. But if clinically you realize that you didn't have the room to be able to set all 4 teeth in the patient, then you would just set the second premolar and the 2 molars. So once we've determined where it is we want to go, we want to make sure that we keep things centered over the ridge and then going up 2/3 up the retromolar pad. Again, a very simple thing to do in order to maintain that is to take a piece of dental floss and lute it with just a little bit of wax to that line that denotes the center of the crest of the ridge. So you can take just a little bit of base plate wax and you lute the floss. And now once you have the floss luted, you want to let the wax get nice and hard. Now you have a nice guide. You can pull that up over the cusp tip of the canine. Because ultimately this is how we want to center the teeth over the ridge. So we want to have all the teeth from that line posteriorly centered over the ridge, over the cusp tips of the canines. We want the central fossas in line with where that floss is. Plus we have our notches still so we can record our occlusal plane. Once we have all of these landmarks positioned for us, we really don't need any more of the posterior rim that we have established for the patient. So we can basically remove the rim to get the rim out of our way, so it's easier for us to be able to set teeth on top of the rim. So taking a hot instrument, again, make sure it's nice and hot because you don't want to move or displace any of the anterior teeth that you've already set. You don't want to cause the rim anterior to where you're trying to cut it back to displace off of the record base. So you just clean up the wax that's lying around. Make sure you don't have any wax up against the distal of the canine so you have a nice clean surface, so whenever you go to set the posterior teeth, you have nothing that's in your way. So now I have a nice clean surface. I have everything positioned. Now you want to use the wax that's in the medicine cup. Again, it's a mixture of base plate wax, red rope wax, and sticky wax. It gives you a wax that has a soft consistency to it, a little bit firm, but it's still soft, and it helps as far as being able to position these teeth initially, so you have a wax that doesn't take much heat or much in order to manipulate the tooth, and that just helps us be able to set the tooth a little easier in place. You don't want a ton of this wax because, again, we want to be able to fixate the tooth in place using a hard base plate wax. We're just using enough wax to help us position the tooth initially onto the cast. So you're positioning the teeth, and again, whenever you're setting these mandibular teeth, you're setting them completely to landmarks. So I stretch the floss, trying to make sure that the central fossa of the tooth is lined up with the floss, and then you want to keep everything on the plane. I'm looking at this situation, I want to have both the buccal and the lingual cusps on the same plane with each other, so whenever I put them into the plate, I should see both the buccal and the lingual cusp contacting that plate. So once I feel like I have everything in place, as far as on that plate, I'll recheck, make sure that I still have everything lined up. And once you feel like you have the tooth centered over the crest of the ridge, you feel like you have the tooth on the occlusal plane, then you're ready to move on. You can either lute that tooth in place or you can start setting the next teeth. Now for this particular situation, as I start setting the teeth, I want to again maintain them centered over the ridge, but I also want to make sure that I have them on that plane and that the curvature is not too extreme. In this particular situation, we're moving the teeth, making sure we have them lined up with the central fossa over the center of the ridge. And you can see posteriorly I have a pretty extreme curvature to it, so I know that I'm hitting my record base and I can't move the tooth. I'm limited by the record base in this situation. So the record base is interfering with allowing me to be able to position the teeth properly where I would like to set them. So when you have a situation like that, you can either start adjusting teeth or you can adjust the record base. And the issue about adjusting the teeth is that often it is when students or lab technicians cut away a little bit too much of the tooth and you end up with too short of a tooth for later on. So here I'm going to remove the teeth, I'm going to remove the record base, and as you can see here, cut a hole completely through the record base. That way we have nothing in our way as far as setting teeth. If I still don't have room after I've cut this hole in the record base, so when I start moving the teeth around, I start hitting the cast, then the only thing I have left is to adjust the teeth. But I just warm up. If you take dead soft base plate wax, it won't stick to your cast. So I'm just taking it and just filling in the hole with this with the dead soft base plate wax. So I'm just trimming it out of my way. And now I have a lot of room now to be able to manipulate these teeth to get them positioned correctly. So now when I go back, I have a lot more room, a lot more freedom to be able to move the teeth around. And again, I go back to positioning everything the way I wanted to originally, where I want to get these teeth centered over the ridge. I want to get the teeth on the occlusal plane. So again, positioning the teeth, again looking at the anterior tooth that I had, you're going to see that the curve of these teeth, these are triolingual teeth, so they actually have a pre-designed curve to them. They will start curving up and they will go above your 2/3 up the retromolar pad. So we're not going to be looking at the 2/3 up the retromolar pad for the molars, just the premolars. So I want to make sure they're centered over the ridge. Again, watch out for the second molar. The second molar is going to be a little bit lingual to our floss if we've set things correctly. But we should have the two premolars and the first molar, the central fossas, lined up with the groove. And then I want to make sure the two premolars are on the same occlusal plane. So I no longer can get to my notch on the one side, but I put the plate on the notch on the other side and I slide it over to the second premolar. Again, we're looking for that curvature that's going to go. That's what the molars are doing, is they're making a compensating curve like you see a picture in the upper right. We could also do that with ramping the teeth like you see in the upper left, or building an acrylic ramp. But for this particular setup with the triolingual teeth, they have a pre-existing curvature to them. So just like the first premolar, I want to make sure that the second premolar, both the buccal and the lingual cusps, are contacting my occlusal plane. The two molars should be going above that. I want to look at the marginal ridges between the first and second premolars just to make sure that they are approximately at the same level. That gives you a reasonable curvature of those posterior teeth to begin with. So as long as I'm centered over my ridge as far as the floss, buccal lingually, and then whenever I bring in the plate in, I have the two premolars, the first and the second premolar, I have those contacting my occlusal plane, then I feel comfortable as far as this being a starting point for having my teeth set. Again, double checking the marginal ridges to make sure the marginal ridges are at a similar level. Once you have those teeth in that position, now I'm ready to get them a little bit more firmly fixated to my record base. So again, taking a hot instrument, I'm going to remove a little bit of this setup wax that we're using to position the teeth, because again it maintains softness. And then I'll take some of the hard base plate wax and I'll flow it around the teeth. Now you will see in these pictures that I just float around the 2 premolars. I don't flow wax around the molars yet. And the reason why I do that is because when we are later setting the maxillary posterior teeth, we may still have to move the curvature or the compensating curve that these teeth are creating. And so there's no reason to embed them completely in wax, so I can't move those teeth very easily. So they're fixated in place once you have the hard base plate wax on there and it's cooled, but that at least gives you a starting point. Now when you go to set the second side of the teeth on the arch, you can set the first premolar and then put the plate onto your notch on that side and extend it around to the second premolar on the opposite side. That helps you maintain the occlusal plane. But the problem comes in whenever you add the posterior 3 teeth that are attached. When you add those 3 teeth, then the molars go above the occlusal plane, and then you no longer have your notch available to you. So when you do that, you're going to have to bring the plate just anteriorly up to the second premolars. That will be your only reference as far as your occlusal plane at that point, because the teeth creating a compensating curve will go above that. So here we basically have the posterior teeth set. We're going to go back through, double check anything, do any minor adjustments that we need to do to again get the teeth centered over the crest of the ridge. Should be the first and second premolars and first molar should line up with the floss, going from that posterior mark that we made through the cusp tips of the canines. We take the plate from second premolar to second premolar, should the buccal and lingual cusps of the posteriors and the incisal edges of the anterior should all contact that plate. And then the marginal ridges between the first and second premolar should be approximately the same level. Once we've done that, we have our mandibular teeth pretty well set. And then we're ready to move on to our maxillary teeth. So just to reiterate, the thing we have to keep in mind when we are dealing with these posterior teeth is this compensating curve. Again, we're using the curvature of the teeth. Now, if you first try to close the articulator, once you've set the mandibular posterior teeth, you recall that we now have this compensating curve that goes above our occlusal plane. So if you tried to close the articulator at this point, you would have a significant anterior open bite because the wax rims that were made to our original occlusal plane are now hitting this compensating curve that extends above our occlusal plane. So other than a reference for how we want to have the teeth extend buccally, then at this point the wax rim has served its purpose as far as being a guide for us to be able to set the teeth. So you can leave the facial surfaces on, or you can remove those and be able to just utilize where the positioning of the mandibular teeth. You really need to look at the relationship of the maxillary anterior teeth to the mandibular posterior teeth to look to see, to ensure that everything is going to look good if you were to remove the rims and you lose that element of guidance as far as where you place the teeth. And here we're taking a hot buffalo knife and cutting down through these wax rims that we put onto the record bases, and we're removing the record bases out of the way. Now the thing you have to keep in mind at this point is now I have lost any vertical stop with my record bases and wax rims in relationship to my vertical dimension of occlusion. This is why it's so very important that when you mount your case that you mount it at 0 on the pin, and now that pin is the only thing that's holding the case at the proper vertical dimension of occlusion that you had established for your patient. So keep checking over and over again the position of that pin. If for some reason that pin is even the slightest bit loose, opening and closing the articulator can sometimes cause that pin to shorten, or if it's loose and the pin's able to drop down while you have the case open, you might slowly be changing the vertical dimension of occlusion for your patient. So watch your pin, make sure it's well locked down at 0, and make sure when you're setting these teeth that you maintain the pin contacting the table with the pin set at 0. So again, we're going to take a little bit of this setup wax, and the maxillary ortholingual teeth are all separate teeth. So if I left off a first premolar, a mandibular first premolar, I would leave off the maxillary first premolar. In this particular situation, we have used both the mandibular first and second premolars. So we're going to use both the premolars and the maxilla. So we're taking the first premolar, place it in the articulator, and then we close it down, making sure the pin is contacting the table. And then we're evaluating it. What are we looking for is we want to make sure that we have two things that are going on whenever we set this tooth. We want to make sure that the pin is sitting down on the table, but we also want to make sure that not only is the lingual cusp sitting down in the central fossa of that mandibular tooth, but we also want to make sure that the buccal cusp is not contacting. Remember, with lingualized occlusion, the buccal cusp is non-functional. So we want to see that lingual cusp sitting down in the lingual fossa with that buccal cusp out of the way. So you can see by this picture we got that lingual fossa right down, or lingual cusp right down in that central fossa. Buccal cusp is not contacting. So we want to start off there with everything eccentric in that position, but we also want to check excursives. Now, because we set the mandibular first and second premolars on a flat plane, I don't usually evaluate protrusive at this point, but I want to check both left working and right working movements. And what I should see is I should see that lingual cusp sliding up the lingual slope of the buccal cusp in a non-working movement, and I should see the lingual cusp sliding up the buccal slope of the lingual cusp in a working movement. Again, the key here is that lingual cusp doing all the work. The buccal cusp should be non-functional. Once I have the tooth where I feel like it is in the best position I can get it at, then I want to lute it in place. Often students start placing multiple teeth and they don't get teeth set and in position and locked in place before they move on to the next ones, and it becomes a functional nightmare as far as being able to maintain tooth position and not to get your teeth to shift into positions you don't want them to be. The other hard thing that students usually do with lingualized occlusion is understand that the more that lingual cusp is lower than the buccal cusp, the easier it is to set these teeth, or the easier it is to functionally set these teeth. So you want to make sure that that lingual cusp is below the buccal cusp whenever you're setting these teeth. It just makes setting them a whole lot easier functionally, makes it a whole lot easier. So keep checking. I always evaluate from the lingual, look at everything, make sure that you're sitting in that central fossa. Again, if you move it into an excursive movement and you see contact in one working movement but not the other working movement, often that is a sign that your lingual cusp is not sitting down in the middle of the central fossa of the mandibular tooth. And so you have to reposition the teeth. So you'll spend a little bit of time adjusting the teeth. And sometimes, like we saw in the mandibular arch, we will run into an issue of the tooth contacting the record base whenever we're trying to position the tooth, especially when we're trying to take the cervical of that tooth and move it in to drop the lingual cusp down lower. We lots of times will run into the record base. And in those situations, I just take whatever tooth off that I need to, and I will cut a big hole in my record base right around where I'm setting teeth, just so it's not in the way. So once you get the tooth in position, you feel like you have it in the central fossa. Again, it being the second premolar, I just take it into right working and left working movements. Again, I should see the same thing that I saw with the first premolar. That lingual cusp contacting the lingual slopes of buccal cusps in non-working movement, the buccal slopes of lingual cusps whenever you go into a working movement, and the buccal cusps should not touch anything. They should be non-functional. Once you get the premolar set, now I want to start bringing in the first molar. And the first molar is going to be where you're going to be spending time with the setup. This is the key tooth to get set up and have it properly positioned. And the other movement we're going to be adding at this point is a protrusive movement. Because remember, the mandibular first molar and second molar all are built on a curve. And so now we should be able to achieve a contact on the molars in a protrusive movement. So just like with the premolars, I'm going to start off by making sure I get the lingual cusps of those first molars into the central fossas of the mandibular teeth. Once I get it there, I'm going to check working and non-working movements. Again, I should see the same contacts as I did with the first and second premolars. The only difference in this case is I take the articulator into a protrusive movement. Now when I take it into a protrusive movement, you should see that lingual cusp riding up. Usually it goes up the buccal slopes of the lingual cusps, more posterior to what you're going to see when you go into a working movement. But again, you don't want to see any buccal cusp contacting even in a protrusive movement. If you have an issue and when you take it into protrusive and you realize that I'm still getting anterior guidance, I'm getting disclusion of my posterior teeth in a protrusive movement, then it's time to kind of start reorienting things. So if I go into protrusive movement and I don't see contact posteriorly, then I'm going to need to go down back to the mandibular arch and elevate my compensating curve, increase the compensating curve. So the two molars, I want to lift those up slightly just to give myself a little bit more of a curvature. Again, we're trying to get a compensating curve like you see on the top on the right. So when you go into protrusive, you have the posterior teeth contacting. So once you move those teeth up, then you have to reposition the maxillary first molar because you've just changed the positioning of the molars and the mandible. You hopefully rotated around the second premolar, so you really shouldn't have to mess with the maxillary first and second premolars. Hopefully it's just orienting the first molar. Once you get that again positioned so you have it in the central fossa, then you want to move it into working and left working and right working movements. Again, I should see contact not on the buccal cusp, and then you want to move it into a protrusive movement. Once I feel like I have that, then just like we did with the premolars, I want to take some hot base plate wax and I want to lute the tooth in position so that it isn't going to move. So these teeth you're going to do individually, but as you achieve that protrusive balance along with left and right working with the lingual cusps, that's when you want to lute these teeth in place. Now once you've got the maxillary first molar set, then usually the maxillary second molar fits in pretty quickly. But you want to start there, and that's where you're going to be spending your time with this setup. Okay, once you get enough wax around those, again, you want to make sure you give the wax plenty of time to cool down before you start manipulating the teeth. But we're just adding wax on there to make sure that we have a nice fixated tooth. Very similar to the anterior teeth, it's nice to try to keep the wax at the same level of all the teeth whenever you're luting them in place, just to keep the appearance similar to your eye so it doesn't throw your eye off. Also, whenever you put some new wax on, sometimes because of the expansion and contraction of waxes whenever they heat, a lot of times you want to go back to the articulator and recheck your movements to make sure that you're comfortable with the movements. Again, what we're looking for here is we're building a compensating curve into the teeth, and so we're curving the teeth with these triolingual teeth like you see in the picture on the top on the right. The two other ways, either tipping the second molar or building the acrylic ramps, are two other ways you can have a curvature, but with these triolingual teeth, they're made to have that curvature to them. Okay, so just double checking, making sure that we have good contact in centric, making sure we have as much contact in left working and right working movements as we possibly can, and also making sure we have contact with that maxillary first molar in a protrusive movement. Once you have that with that maxillary first molar, then usually the curvature that you've established is going to work well between the arches, and so now it's really just a matter of positioning the maxillary second molar and making sure again that you have the lingual cusp centered in the mandibular central fossa, making sure that you have the buccal cusp out of the way so that it doesn't contact in right working or left working movements. And then you also want to make sure that you have contact with the teeth in a protrusive movement. So I'm going to put that on the articular again. I'm going to check in both working, non-working movements and also check in protrusive movements. And I should see contacts in all those movements. Again, only with the lingual cusp. The buccal cusp should be non-functional. So I'm going to check all those movements and make sure that I'm feeling comfortable with everything at that point, that I have all of the correct positioning between right working, left working, and protrusive. So as just a quick review of what we're trying to achieve here, we're showing you one side of it here. Ultimately, we want to place the other side. But what we want to see is we want to see really good, solid centric contacts whenever you have the articulator closed and centric. The lingual cusp should be the only thing that's contacting. So when you turn the articulator around and look from the lingual side, you should only see the lingual cusp sitting down in the central fossas of the mandibular teeth with no buccal cusp contact. And when you go into a protrusive movement, those lingual cusps of the molars should be going up the mandibular teeth. No buccal cusp should be contacting, but you should have molar contact. And working, the lingual slope should ride up the buccal slope of the lingual cusp, and the buccal cusp should be non-functional. And on the non-working side, you should have the lingual cusp riding up the lingual slopes of the buccal cusp, and again, no buccal cusp contact. Once you have positioned those teeth in their position, again, you want to make sure that you add the hard base plate wax around the teeth to make sure that you have the wax firmly, or the teeth firmly, in place. When you go back to the mandibular arch, now that we have those teeth in position, I can now add some hard base plate wax to the molar area to get those well luted in place now. Again, we left the wax off of the molars initially so that we could manipulate them easier whenever we were going to change our compensating curve, if we needed to change our compensating curve. But now that we have both the maxillary and the mandibular teeth in the position that we want them to, now it's time to go in and add some hard base plate wax to those teeth to lute them in place, to make it start filling it in as far as the festooning or the characterizing of the gingiva that we're going to do. Okay, we want to always go back at the end after we've gotten all of our teeth set. We've added that wax to firmly lute them in place. We want to go back over and double check all of our movements. Again, making sure that when we go into a working movement, a non-working movement, or a protrusive movement, that we don't have any buccal cusp contacting. It's all lingual cusp. And we should have as many contacts as we can in those movements. So we want to double check on the articulator to make sure that we have all the contacts that we have that we want. Then, now that we have the buccal surfaces all sealed with wax, the teeth are firmly in place. Now we still have the lingual surfaces of the teeth in order to fill in as far as the wax. You want to make sure that buccal surface is nicely firm, the wax is hard. Then you're going to take a sheet of base plate wax that you warm up till it's dead soft, and then you can very gently adapt that wax to the lingual surfaces of all of those teeth. Again, if you look at the lingual surfaces of the teeth, there is a coloration line that you see, and that is the point at which you want to take the wax up to on the teeth. So I want to adapt the wax in, and then I'll come in with either my number 7 wax spatula, with a buffalo knife, something like that, and I will trim the wax back, and then I'll take a nice hot instrument and I will smooth the wax as far as into the rest of the wax and the record base. So here we're just adapting some of the wax around a little bit with our finger, with the end of the instrument, and then ultimately we want to go and take the instrument and get the instrument nice and hot and just blend the wax in as smoothly as you can. But this helps us to be able to not constantly add liquid wax to the teeth. Lots of times the more you heat up the wax, the more the wax will shift whenever you're trying to place the teeth, or the wax will change a little bit over time. This way we have the bulk of the wax that's soft, but it has not liquefied, so you're going to try to minimize that expansion and contraction that occurs with the wax. And the maxilla, again, we added some base plate wax to the buckles of the teeth, and we've got those firmly luted in place. Now we're going to come in and same thing, we're going to heat a sheet of base plate wax until it's dead soft. We're going to roll it up, and then we're going to very gently adapt that to the lingual surfaces of the maxillary teeth. So again, adapting it very slowly and gently, again making sure that the teeth are firmly luted in place on the buckle with well set and cooled base plate wax. So we adapt it with our fingers, again either taking a buffalo knife or a number 7 wax spatula. You're going to trim away the excess. You can adapt a little bit more with your fingers, and then you're going to take a hot instrument and blend that wax in with the record base so you have a nice smooth transition of the two. So here we're taking a hot instrument and just again smoothing the wax, making it blend in nicely with our wax rim of our patient so that we can have nice contours of our wax. You can sometimes take the instruments into the embrasures between the teeth just to make sure you have some wax filling in those areas. So just taking it, smoothing it up. As a final review, once we get the other side of this arch set, what we're looking for is we want to see good centric contacts of the teeth with the lingual cusp sitting in the central fossas of the mandibular teeth. You want to make sure when you look from the lingual again that you see those lingual cusps sitting in the central fossas of those mandibular teeth. And when you go into a protrusive movement, you should see posterior teeth contacting, but no buccal cusp contacting. You also want the incisal edges of the anterior teeth contacting. When I go into, this is a non-working movement, I want to see the lingual cusps of the maxillary teeth going up the lingual slopes of the buccal cusps. When I go into a working movement, I want to see the lingual cusp going up the buccal slopes of the lingual cusp with no buccal cusp contact.